Hello, my name is Carlos Vega, a student for American English class from Dr. John Moscoso of 4A. And my topic tutorial is Transplanting Hepatitis C positive kidneys. So first of all, we have the definition. Kidney transplantation from hepatitis C virus, a HCV positive donor to an HCV negative recipient till recently has been a contraindication in view of the excellent sustained virological response rates with directly acting antiviral agents. HCV positive donors are being considered for HCV negative recipients in a few centers. We report the successful transplantation of HCV negative recipient transplanted with a HCV positive donor kidney.
In the expander study, we transplanted 10 patients with kidneys from hepatitis C positive deceased donors and treated them simultaneously with antiviral medications for hepatitis C. We had excellent transplant outcomes in these recipients and were able to prevent long-term transmission of hepatitis C from the donor to the recipient. So we were able to successfully treat all 10 recipients and prevent long-term transmission of hepatitis C from the donor to the recipient. They also had excellent outcomes following the transplant in terms of kidney function and recovery. Currently, there are about 1,000 kidneys per year in the United States that are not utilized because the donor is hepatitis C positive and there's no appropriate recipient to place them into. They're otherwise excellent kidneys, so we hope to be able to use them in recipients that already have a long wait for a kidney transplant and treat them with the antivirals that can successfully treat hepatitis C. And so long term, we hope to transplant many more patients with hepatitis C positive kidneys along with treating them for hepatitis C to have both a successful transplant outcome and also prevent transmission of hepatitis C. We hope to take the results of the expander study and apply it to other organ groups as well, especially patients waiting for heart transplants and lung transplants. Both of these populations could benefit from a shorter waiting time. And since there are organs from hepatitis C positive donors, both hearts and lungs that are currently discarded because there isn't an appropriate recipient to put them into, we hope that we can put these kinds of transplants into hepatitis C negative recipients, treat them with the antivirals for hepatitis C, and have successful outcomes.
Application in medicine. The first generation of DAAs were approved by the Food and Drug Administration, or FDA, in 2013 for the treatment of chronic HCV infection. Rees et al. Offered a perspective of how DAA therapy could change the perception of using HCV positive organs in transplant candidates with or without pre-existing HCV infection. The main advantage of this approach is a significant reduction in waiting time compared with HCV negative kidney. Initial interest was focused on transplanting HCV positive kidney into HCV positive recipient, and early reports describe excellent outcomes. Accepting an HCV positive kidney was associated with a significantly decreased waiting time with excellent safety and efficacy of DAAs. In one study, Bamid Imari et al. Report a median waiting time of transplant of 58 days after entering the patient into a unit to accept an offer from HCV positive donor. Or of importance, these studies brought attention to potential drug-drug interaction and the need to be vigilant with calcineurin inhibitor dosing to maintain therapeutic levels. The sustained viral response in these studies was consistently above 96%.
Not like yesterday, the day before. Oh yeah, we do have bears up here. It reminds me of Night of the Living Dead, believe it or not. You see how the zombies are walking towards you? That's exactly what they look like coming out of dialysis. I'm not kidding. Here we go. Say hi. The concept of getting a very good kidney with small traces of the virus and then getting treated for the virus that's curable, it just makes sense to me. Maybe. That would be good. Oh, that's funny.
It'll be there all year round.
I was thinking of putting it on this side. I can attach it.
More sane.
If they didn't have this study, I wouldn't be where I am today. So I'm extremely grateful. Because I have nothing to complain about.
Believe me, I'm really happy
I mean, it's
about
so
it.
weird. I feel like I'm such a bad patient.
We're giving them the opportunity to have a transplant, but we're also treating them for a new infection that they didn't have. So that's the trade-off.
Are you ready?
No, that's fine, but if you want, I'm available, if you don't.
There's a whole pool of kidneys that we just kept looking over. It was like we had blinders to it.
And unfortunately, if the numbers keep increasing, the number of available organs that we could use might actually continue to increase as well.
Pros and cons. Transplanting a kidney from HCV-infected donor into HCV-positive or HCV-negative recipient is an exciting opportunity to increase access to transplantation. In geographic regions where waiting time exceeds 5 years and patients are preemptive or with short dialysis vintage, the option of accepting an HCV-positive organ may be more compelling. In addition to a significant reduction in wait times, kidneys from HCV-positive donors are often of excellent quality because the donors tend to be younger than the general donor population. Cons. In the real-world settings, rapid access to DAA may not be easily achieved because these routes are only FDA approved for the treatment of chronic and not acute HCV infections. The implied advantage of accepting an HCV-infected kidney, shorter wait time and higher quality kidney, must be weighed against the risk of VSH, altered immune responsiveness leading to the emergence of other viral infections, and potential logistical challenges to obtain the DAA medication.
very happy to say that we've been able to implement the program successfully, ensure that our patients have access to organs that they might not have otherwise had access to. In my experience, virtually all folks who I've talked with before transplant, after hearing the pros and cons, have decided that it made sense for them to consider using such donors. I think we're all saying it's awesome because we see patients who have received and are doing well after an organ transplant who might not have lived to organ transplant if, for whatever reason, we had not had this program in place. I think none of us would have even had this discussion 10 years ago, but it's been made possible by the fact that we have good drugs for hepatitis C, that there's a growing body of evidence from multiple centers suggesting it's safe and feasible, and that there has been this increase in the number of potential donors who have hepatitis C. So all those have come together to make this the right time to consider and implement such a program. We're looking forward to continuing the process, broadening potentially this program to other organ transplants, again, ultimately with the goal of improving access to a life-saving procedure that patients might not otherwise have the opportunity to have.
The treatment went fine, no problems with that, no side effects. And the Hep C responded well in 8 weeks, and I was done. It's totally worth it. Of course I thought about it, but after all I've been through with the total artificial heart and, you know, just missing some matches by one antibody, because my antibodies were really hard to match, and I would have been foolish to say no. That's why I signed up, because it was getting to the point where I had to do something, you know, and 2 weeks later they found a match, and I've actually talked to her about it, and, you know, and other patients that are waiting for a transplant, and I told them, sign up, you know, do it. It's not anything to be afraid of. It's totally curable, and it drastically increases your odds of finding a match. It feels good to walk around and without pushing something around with me and being tethered to a machine all the time. And yeah, it's great to be able to just walk outside and do what I want to do, and work on my truck and do projects outside that I haven't been able to do for so long. Yeah, feels good to get back to normal life.
Issues applying in Ecuador. There are not many studies on the subject, and much more needs to be learned about the process. Conclusions. From the discussion, it is apparent that the patient nephrologist should be well informed about all the variables that might factor into an appropriate informed consent before the patient accepts a kidney from HIV-infected donor. The patient will be faced with a complex decision, with many nuances that many may not be prepared to make. In all likelihood, the patient will turn to the nephrologist for recommendation and guidance. Thank you.